All right, well, good afternoon, everyone. Welcome to today's Age Well series presentation titled Mind Matters, Navigating Mental Health in Older Adulthood. I'm really excited for today's presentation and just wanted to welcome you. My name is Jill Rankin. I'm the Executive Director for the Wisconsin Institute for Healthy Aging, or WIHA. And WIHA's mission is to support the health and well-being of all people as we age here in Wisconsin. And if you haven't already, we encourage you to take a look at our website to learn more about our programs and initiatives and all the partners that we work with throughout the state of Wisconsin, as well as nationally. And then also you can sign up for our Age Well newsletter if you haven't received that already. We a lot of times like to publish a lot of really great health education information, including information like today's webinar. So just a few housekeeping items before we get started. All participants will be muted during the presentation, and we ask that you use the chat box function if you have any questions or comments for the speaker. We're going to have some time for a Q&A at the end of the presentation. And also just know that the webinar is also going to be recorded, so you're welcome to listen to it afterwards as well, and that will be emailed out to all of the registered participants for today's webinar. So we hope that you enjoy the presentation, and I'm going to hand it over to Suzanne Morley, who is going to introduce our speakers and tell you a little bit about the background of the initiative that we are working on here in Wisconsin with Social Connection. Thanks.
Thanks, Jill. Like I said, I'm Suzanne Morley. I'm a health promotion program coordinator with the Wisconsin Institute for Healthy Aging, and we're happy to host this webinar in conjunction with the Wisconsin Coalition for Social Connection. The Wisconsin Coalition for Social Connection was established in 2020, and WIHA functions as the backbone organization. The coalition includes members throughout the state actively working to address social isolation and loneliness and increase connection and network, and includes a network of people receiving news and updates and utilizing resources to help improve opportunities for social connection for older adults and people with disabilities in their communities. So with that, we have a great lineup of speakers today. So we have geriatric psychiatrist, Dr. Rebecca Radu, Danette Hopke with the UW-Madison Division of Extension, and Mark Miller with the 988 Wisconsin Lifeline. I'm going to pass it over to Dr. Radu, who will focus on changes in mental health as we age and the importance of social connection for mental health.
All right. Thank you so much for having me. It's great to be here. We can go ahead and go to the next slide. So this is what we'll cover today. We're going to talk about normal aging and development. We'll talk about the importance of social connection for older adults and older adult mental health. We'll review some common mental health concerns that older adults might face, summarize some key points, and then hopefully have some time for questions and discussion. Next slide, please. So what is aging? Next slide. So aging is, this process of growing older and maturing, and it happens due to this really complex interaction of a number of different things, our genetics, our chemistry, physiology, and our behavior in our environment and our life experiences. All these things kind of contribute to our individual aging processes. So next slide, please. So Erik Erikson kind of proposed these stages of psychosocial development. And for older adults, there's this, the developmental stage is titled integrity versus despair. So if we go to the next slide, you can see that this is for folks 65 plus, and the idea is, did I live a meaningful life? And it's kind of focused on life reflection and celebrating wisdom and all that folks have achieved and gained. And so that was kind of proposed as sort of our last developmental stage that we all go through. Next slide, please. So I just want to send a message, of course, yeah, as a geriatric psychiatrist, this is what I see, day in and day out, but depression and dementia are not inevitable with aging. They're not kind of part of normal or typical aging. And although there are a lot of stresses associated with aging, some of which we'll talk about, most people demonstrate really high levels of resilience in the face of those challenges. Next slide, please. So while we can't always avoid physical decline, losses, and transitions, sometimes cognitive impairment or mental health concerns, our goal as geriatric psychiatrists and our goal in older adult mental health is to work towards optimal quality of life. Next slide, please. So here are my goals as a geriatric psychiatrist and in teams that I've worked with. We want to reduce distress and symptoms, improve folks' overall functioning. We want to work to maintain as much independence as possible and really improve quality of life. Those are my focuses. Next slide, please. So what changes do we expect with normal aging? Next slide. So there are, of course, changes to our hearing and our vision as we grow older. We also see that medications can affect us differently because we have things like increased body fat and decreased muscle mass. Kidney and liver function can change, and we might have decreased digestive speed as well. That kind of slows down over time. And that can affect how medications and substances and other things might affect our bodies. And then in terms of cognition, we can see things like decreased processing speed, just not quite moving as fast, decreased ability to multitask, and then decreased working memory. So just like the ability to hold on to things and manipulate like multiple different ideas at the same time. But none of those things should really lead to challenges in functioning. So just to throw that out there. Next slide. So just to talk about the importance of social connection for older adult well-being. So of course, social connection and loneliness are kind of two separate things. So I'm going to talk about loneliness and social isolation as though they're interchangeable, although they can be very different. You know, someone might have tons of social connections but still feel very lonely, and someone else might be, essentially unbefriended or not have as many social connections and not experience loneliness. Loneliness, as it's been studied, actually peaks in middle age. Older adults are actually less likely to report being lonely or experience the experience of being lonely past middle age. Social isolation and loneliness, both as separate concepts as they've been measured, have negative health sequelae, and they can actually rival smoking in terms of the impact on mortality. Social connection, on the other hand, is associated with health benefits like increased survival and better ability to tolerate stressors, not just stressors in our environment, but also stressors like illness or injury. And certain health and lifestyle factors are associated with decreased loneliness in later life. So folks who get better sleep, folks who exercise, folks who are sexually active, folks who have a religious community, folks who know their neighbors and are connected with their neighbors, and then folks who do volunteer work are all less likely to report loneliness or report being lonely. And so while all of this is wonderful and true, you would think that we could design all these interventions that might be helpful. And there have been a number of studies, but the support for interventions, many of those studies have been kind of neutral or even not even negative. The best data that we have is actually in long-term care settings, which I could go into why that might be, but the best data is actually for animal therapy and technological interventions. So actually getting folks, iPads and allowing them to connect on social media, things like that. And then animal therapy, bringing in, dogs and cats and having pets in long-term care settings has been shown to be beneficial. Next slide, please. So while we know that better social connectedness predicts better outcomes for older adults living with mental illness, we know that when we talk about social connection, we're not just talking about family, we're talking about chosen family and friends and communities, neighbors, folks that, might be anybody who might be part of someone's life. And as a geriatric psychiatrist, I do see a number of what we call unbefriended older adults who, don't have those social connections, those resources. And these folks almost always have a harder time. But it's important to remember that, for me, anyway, it's important for me to remember that what I see is not necessarily the norm. My sample is biased in that way. Next slide, please. So social connectedness is a key to well-being. It's an important thing. Next slide, please. So we'll talk a little bit about mental health concerns that older adults might face more commonly. Next slide, please. So this is just a list of reasons why people might most commonly come to see me. Next slide, please. So when we talk about older adults who are living with mental illness or mental health concerns, we are talking not just about those who have developed mental health concerns later in life, but also folks who have aged with living with lifelong anxiety or lifelong severe and persistent mental illness, such as bipolar disorder or schizophrenia. So we're talking about kind of multiple subsets of folks. Next slide, please. So just here are some statistics. The World Health Organization suggests that 15% of adults over age 60 are living with a mental health condition, and anxiety is the most common psychiatric symptom in older adults. And that's actually across the lifespan, that anxiety disorders or anxiety is kind of the most common mental health concern. SAMHSA estimates that depression affects 3 to 7% of older adults. When you go into long-term care, those numbers go up more. When you go into folks who are acutely hospitalized, those numbers go up more. Folks who are facing an illness like cancer or a neurologic illness like Parkinson's disease, those numbers do go up. In 2004, older adults, just to kind of highlight the importance, and so thankful that we have 988 folks here today. So while older adults made up 13% of the US population in 2004, this has been an old statistic, 18% of suicides were older adults, with older white men remaining at the greatest risk. SAMHSA reports that over 1 million US adults over the age of 65 actually met criteria for a substance use disorder, and that's from 2014. So next slide, please. These are just some psychosocial considerations for older adult stressors that folks might face. I'll go ahead and go to the next slide in the interest of time, making sure we have time for everyone. There are a number of medical issues that can mimic mental health symptoms. Certainly thyroid problems, cardiac or other vascular problems, like folks with atrial fibrillation, that's not been diagnosed. That's a type of arrhythmia. They might experience anxiety when they have an episode, and they might be diagnosed with anxiety and miss the arrhythmia. Medication side effects or drug-drug interactions. As we grow older, we tend to be put on more and more medications, and those medications can interact. Urinary tract or other infections, if somebody has a pneumonia or if somebody has a COPD exacerbation or diverticulitis, a variety of potential for anytime there's inflammation in the body, there can be risk of anxiety, depression, other mental health symptoms. Vitamin deficiencies, as we grow older, we tend to accumulate those a little bit more than younger folks. So my message here is basically if you or a loved one have a sudden change in behavior, a sudden new mental health symptom, it's really important that you see your doctor and, get evaluated to see if maybe something is going on like this. So next slide, please. Talking about anxiety in older adults, we'll go to the next slide. So this is a chart of anxiety disorders across the lifespan, and you'll see that in childhood, we have a lot of phobias and worry. And then as we move over to older age, panic and PTSD symptoms kind of diminish a bit, but fear of falling becomes a very big issue, and worry can certainly spike. Phobias do tend to decline like across the lifespan. Next slide, please. So here are just some of the symptoms that folks might experience. So I'll go ahead and go to the next slide in the interest of time. So anxiety disorders are the most common. And so I just want folks to know, if you're struggling with this, you're not alone. Work with your doctor to find the best treatments for you and keep close with your social supports. Next slide. In terms of treatment opportunities, talk therapy or psychotherapy is very beneficial for anxiety, kind of does the best job at providing long-term relief and long-term recovery. Exercise can be very helpful. And then antidepressant medications, we call them antidepressants, but they're really gold standard for a number of different mental health concerns, including anxiety disorders. Next slide. I just wanted to throw in a note about post-traumatic stress disorder and trauma. So trauma is incredibly common, and older adults are certainly not immune, both to trauma later in life, but also to having experienced trauma in childhood or earlier in life. And PTSD symptoms can emerge or even reemerge later in life. I definitely see that happen, especially in folks who develop cognitive impairment. Um, and so trauma-informed care is just so important across the lifespan, and it's really critical that we make sure that sites where older adults receive care are practicing trauma-informed care. Next slide. So talking about depression in older adults, we'll go to the next slide. So it's important to note that anxiety and depression have a really large overlap. So something like 48% of people with depression will also be experiencing anxiety, and 26% of people with anxiety will also be experiencing depression. Next slide. So this is what depression might look like in older adults. Next slide, please. And this is just referencing the prevalence of depression across different medical conditions. So you'll see that folks with Parkinson's, over half will experience depression. Folks with Alzheimer's disease, also very common. Folks living with cancer, also very common. But also common among diabetes and folks who have had a stroke or live with heart disease. Next slide. So just a word about depression versus apathy. Apathy is common in dementias and stroke. It's a little different from depression. So it looks like lack of motivation, not wanting to go anywhere, requiring constant prompting to do things. If folks are left to their own devices, they may just kind of sit on the couch and watch TV or just sit and stare into space even. If it's really severe, folks may not eat or drink without prompting, and that can get folks into trouble for sure. Only depression will have associated low mood and may come with feelings of worthlessness or sadness. The thing with apathy is that it usually bothers not so much the person living with the apathy, but the folks around them. They're like, gosh, why doesn't my spouse or why can't my mom just, like do what they used to do? Why do they just want to sit there? And so I just wanted to throw out this little bit of education about apathy here. They can both lead to people not enjoying things that they used to do. Apathy in general is harder to treat than depression, but can be treated in many cases. So next slide. So just some tips for older adults and caregivers. We'll go ahead and go to the next slide in the interest of time. So this is just a list of medication options for depression. We can go to the next slide.
You're doing really good on time. You have about 11 minutes left, so feel free.
Oh,
Yep,
I
you have
do.
plenty of time. Yep.
Okay, magnificent. Apologies. I thought it was divided in thirds. So, all right. So talking about non-medication treatments for depression, there are a number of different options. So one thing that I like to talk about is bright light therapy because it tends to have very few side effects. You'll see over in the picture on the side here, someone sitting in front of a sun lamp, very bright light. These lights, you want to make sure if you are going to utilize this therapy, you want to make sure that you get a light that emits 10,000 lux. That's the therapeutic dose or the therapeutic intensity that you want to have. And basically, you sit in front of this light in the morning, ideally before 10 a.m. if you're on a typical schedule, typical day schedule. If you're on if you do shift work or something like that, we can modify it to make it still be helpful. in terms of timing. But you would sit in front of it for ideally a half hour as many days of the week as you were able. And it's a very, very evidence-based treatment for depression. Even safe in bipolar disorder generally has a very low risk of manic switch. And so can be helpful for bipolar depression too. But this is a great treatment that I recommend to a lot of my patients. Can be really helpful and tends to come with very few side effects. Occasionally, people will get headaches or have trouble with their eyes, but that's not very common. Um, and then talk therapy or psychotherapy, again, also a wonderful treatment option for depression. Once the depression is moderate or severe, we generally recommend combining talk therapy with medication therapy, but talk therapy is just as effective for mild to moderate depression as medications. So very important to note that. Exercise can also be really beneficial. Just a word, when I'm talking about exercise, I'm actually talking about cardiovascular exercise where you're getting your heart rate up to that target heart rate, ideally 30 minutes a day, 5 times a week if you're able. That's really how it's best been studied. Not that weightlifting isn't wonderful and beneficial, but cardio is really the exercise of choice for anxiety and depression. There's also this treatment called repetitive transcranial magnetic stimulation. Basically, it's like you wear a cap and there's this machine, and they use magnets to stimulate a particular area of the brain that leads to remission of depression. Can be very effective. Also has been studied in some other conditions as well, such as helping with language recovery after stroke. But this is a non-invasive, very low risk procedure that can be helpful for treating depression. And then I just wanted to talk just a brief bit about electroconvulsive therapy or the old shock treatment. So that has come a long way, and is our most effective treatment for depression, both for unipolar depression and bipolar depression. And when medications fail, or when we have someone who's very, very ill and we need to get them better quickly, ECT is really our best, most effective treatment. And in my residency, I did help with that. And so, yeah, it's just a gentle, effective treatment. Does come with some potential risks, but in general is safe and effective. So just wanted to put a plug in for that. Next slide, please. So just wanted to talk about Alzheimer's disease and other dementias. So if we could go to the next slide. So this is a slide talking about warning signs of dementia. Things like memory loss, which we typically think of, difficulty performing familiar tasks, problems with language, struggles with judgment, misplacing things, withdrawing from work and social activities, trouble with images and spatial relationships. Oftentimes this can come out in driving, but sometimes other things as well. Changes in mood and behavior. We'll talk a little bit more about that too. Problems keeping track of things, and then disorientation to time and place. So these are just all some potential warning signs to be aware of. We can go to the next slide. So there are different types of dementia. So when we're talking about dementia, I'll just sort of draw out that there's a stage that's a precursor to dementia called mild cognitive impairment or mild neurocognitive disorder. And that's where somebody has some cognitive changes, but it doesn't affect their functioning. Like it doesn't affect their ability to perform day-to-day tasks, get things done. And so sometimes folks have mild cognitive impairment and they never progress to dementia. But some folks who have mild cognitive impairment do progress to dementia. When we're talking about dementia, it's actually broken down into a lot of different things. The most common, we always think about is Alzheimer's disease. That's the most common type of dementia. Second most common is vascular dementia, followed by frontotemporal dementia, which vascular dementia is basically caused by problems with the blood vessels in the brain. People can have like a lot of tiny little baby strokes in their brain, or even bigger strokes can lead to problems. And so that's sort of how vascular dementia presents. For frontotemporal dementia, that tends to strike younger, unfortunately, and does come, there's sort of two variants, or well, there's more than two, but one has a lot of behavior changes, and folks can be acting very out of character. And then the other is a language variant where folks have a lot of trouble with language. Um, then there's Lewy body disease, which is related to Parkinson's disease, but is kind of its own thing. And so I just wanted to kind of provide that overview just so that you know that there's mild cognitive impairment and dementia, and that dementia is broken down into a lot of different potential diseases or causes. And dementia is defined as problems with thinking or memory or, various cognitive issues, as well as functional impairment, so difficulty getting things done, doing daily tasks. Next slide, please. So just wanted to talk about behavioral and psychological symptoms of dementia. These are incredibly common and can even present in the mild cognitive impairment stage. The most common are anxiety and depression. But there can be, folks can develop, delusions or hallucinations, or folks can be kind of disinhibited or inappropriate. And so these changes can cause a lot of distress for the person living with dementia and for their family and loved ones. But these symptoms are treatable. And in my former job at the Veterans Hospital, this is mostly what I did was treat behavioral and psychological symptoms of dementia. And so just want people to provide that education. Next slide, please. There are a lot of safety issues to consider. So whenever I'm giving a diagnosis, I'm always trying to be proactive and talk about safety planning for these things. Next slide, please. So for folks who are caregivers, as we age, we're more likely to be in a caring role, where we might be caring for a spouse or, for some of us, an adult, a parent, or a sibling, or even a friend. And depression and burnout are really common among caregivers. 32% of caregivers for people with Alzheimer's disease live with major depression. And we know that treating mental health concerns in caregivers leads to better outcomes, not just for them, but for the people that they're caring for. And support groups and organizations can be really helpful. Next slide, please. So substance use disorders in older adults, I slowed down a little bit too much, so we'll go ahead and go to the next slide. So these are just some statistics. I'll go ahead and go to the next slide. The really good news about substance use disorders. So we know alcohol is the most common substance of abuse, but older adults aren't immune from, potentially struggling with other substance use. But the really good news is studies have really shown that treatment is just as effective, and some studies have even shown more effective for older adults as it is for their younger populations. So it's really important that we get folks into treatment. Next slide, please. So recapping, so depression, dementia, other mental health issues, not the norm as we age, but absolutely can happen. Social connection is protective for older adults' mental health and well-being. Anxiety disorders are the most common mental health concern in later life, but there are others. And the good news is that mental health concerns are very treatable in older adults. And you don't just have to see a geriatric psychiatrist, you can absolutely see your primary care provider. As a good place to start for many of these things. So next slide, please. So thank you so much. And I appreciate you having me. This is just me with my Nana. She lived with Parkinson's disease, and this is me and her at my med school graduation years ago.
Awesome. Thank you, Dr. Du. We will save questions until the end, but if you do have any questions, feel free to drop those in the chat. And I am going to turn it over now to Danette with UW-Madison Division of Extension, who's going to be sharing about their We Cope program and a little bit about positivity. So Danette, I'll let you take it away.
All right, that sounds great. Thank you so much, Suzanne, for the invitation, and a great opportunity to follow that fantastic presentation as well. And hopefully you'll see some of the themes that Dr. Radu talked about show up as we talk today about the We Cope program. So I'm Danette Hopke. I'm the Behavioral Health Program Manager for UW-Madison's Division of Extension, the Health and Wellbeing Institute. And you can go ahead and hop to the next slide. I'm here today to talk about our We Cope program, as Suzanne mentioned. This is a program that was developed based on the research of Dr. Judy Moskowitz, which I'll talk about in just a moment. But in this program, we teach 11 different self-care and healthy coping skills over the course of 6 to 7 weeks. They're hour-long sessions. And these skills are meant to help all of us connect with our positive emotions. And we'll talk about the power of that and the research behind that as I have some time here today. So some of the skills, go ahead to the next slide. Some of the skills that we will talk about in our We Cope program are things like noticing positive events, capitalizing on those positive events by savoring and reflecting. We also talk about gratitude and mindfulness, positive reappraisal, how we can reframe experiences in our lives. We also talk about experiencing and noticing our personal strengths and really leaning into those, especially as we set daily goals for ourselves, and maybe even bigger than daily goals, how we can utilize those personal strengths to build on that. And finally, one of the other skills that we talk about are acts of kindness, and how acts of kindness are really a threefold opportunity. And if we've got time today, we'll explore that just a little bit as well. So go ahead to the next slide. Great. As I mentioned, the We Cope program is based on the work of Dr. Judy Moskowitz, and at UW-Madison, we also have Dr. Larissa Duncan, who was a partner with Dr. Moskowitz in the early days of this research. And on this slide here, you'll see a bunch of different randomized controlled trial studies with lovely plant or leaf names. And really what this slide represents is the depth of the research that went into creating this We Cope program, which involves, again, recognizing the value and the power of connecting with our positive emotions. And if you just take a peek at the slide, you'll see on the far right side the wide variety of audiences that these skills were tested with in individuals to really show and to demonstrate that there is truly a research-based impact of connecting with our positive emotions, even when in our lives we're dealing with some really stressful things in our lives, such as chronic disease, severe and terminal diagnoses, as well as caregiving. And we know that caregiving has a profound impact on many people's lives as well. So this work, again, in our We Cope program is deeply rooted in this research and was developed in collaboration with Dr. Moskowitz and her team. She's at Northwestern University. And again, our own Dr. Larissa Duncan at UW-Madison Division, who supports the Division of Extension, as well as the School of Human Ecology and her work. Next slide, please. So just to talk a little bit more about the We Cope program, it really emphasizes the empower in increasing our awareness of our ability to experience emotions and helpful or positive emotions, even during those times of stress in our lives. What all of this research has shown us is that positive emotions are connected to better health outcomes, which include things like decreased inflammation in our bodies, decreased pain, improved cardiovascular health, resistance to infection, improved immune system function. Many of the things that Dr. Radu talked about that can be challenges that we face as we age, we know that when we are able to connect to our positive emotions, our bodies become more resilient and our brains also become more resilient. Positive emotions also promote optimism and adaptive coping responses, which again support that physical and mental wellness that we both have been talking about here today. Our team has also seen an increase in reports of social connection among participants in our program. We have educators around the state that teach this program both virtually and in person, and even the participants engaging in the virtual settings have noted the positive impact of being seen and being heard and connecting with others in that virtual platform. And we're seeing the same thing in our in-person setting as well. And as Dr. Radu noted, it is so important that we include social connection as a part of our lives across our lifespan. We Cope also seeks to dispel the myth that people with a positive outlook on things are just simply not acknowledging that bad things are happening. Instead, what We Cope says is that we acknowledge that life is full of all kinds of stressors. And in the midst of those stressors, just as I said before, we still all have the ability to connect with positive emotions that can really help us face that adversity and learn from our mistakes and even cope with the mounting challenges sometimes that life brings our way. Go ahead and hop to the next slide. We know that this skill set isn't about always feeling good all of the time or ignoring the negative. Again, it's about acknowledging our feelings for what they are and recognizing that we still, in the midst of challenges, have the ability to feel love, amusement, curiosity, and other helpful or positive emotions. We also know that positive emotions are found in experiences like kindness, insightfulness, resilience, determination, and so much more. And the skills that we teach as a part of this We Cope program really lean into helping the participants explore how to connect with those emotions. All right, excellent, fantastic. Thanks for anticipating my slide advancement. As a part of We Cope, we work to increase the awareness of how important our emotions really are, and that we get clues about our emotions from a variety of different ways. And so we often in the program talk about noticing our thoughts, our feelings, and our physical reactions, our feelings being our emotions, and our physical reactions to stressors that we experience in our lives. And many times as individuals, we experience stressors very, very differently. And so we learn to train ourselves to key into all three of those stages of awareness so that we can become more aware of the feelings that we're experiencing. And then we also work to be able to increase our awareness and notice and identify and label those emotions more clearly as a part of the work that we do. And that gives us important information about the situations that we are experiencing, and then helps us to be really fully present in a cognitive decision-making process on how we want to choose to respond to those situations, and be more prepared and engaged with those positive emotions along the way. All right, so let me share just a little bit. We can skip 2 slides. We'll just jump right to the slide with some of the research. So I talked to you kind of an overview of the research that has happened, but here are a few things that the research has really shown related to the skills that we teach in this We Cope program. We know that individuals that are able to connect and experience their positive emotions, they're able to cope with their negative experience and stressors in a more healthy and helpful way. We also know that those positive emotions protect against the negative health effects of chronic stress, some of which I mentioned earlier. We know that individuals that are able to connect to those positive emotions are perceived by others around them in a more positive manner. And when they're perceived in a more positive manner, it increases the value of positive social connection as well. We know it also improves our ability to be problem solvers, which can improve our success in a wide variety of settings. We have better performance, sometimes at a hobby or a skill. If we're still in the workforce, it can also improve our ability to be successful in the work setting. We become better teammates. We experience lower rates of burnout, higher rates of engagement and empathy, and it also increases our relationship satisfaction and the quality of those relationships, both in with those intimate partners, as well as families and other family members and friends as well. I apologize. Like Dr. Radu, I'm trying to talk really quickly so we can cover as much content as possible today. One of the things that we talk about is noticing positive events. And so I just have a couple of minutes, but I really want to, oh, awesome. I just saw a comment pop up. We saw people participate in a course a few years ago. Excellent. Is noticing positive events and really the power that noticing positive events can have in our day. And when we talk about noticing positive events, we're not talking about noticing big and monumental things. We're really encouraging people to lean in and notice the small everyday things that happen in our day. So it might be a song that played on the radio when you were in the car. It might be a phone call that you received from a friend. It might be just simply enjoying your cup of coffee. I don't know about all of you, but I personally just really enjoy my first cup of coffee every morning. And when I can start my day just really cherishing that, and adding to that a sense of gratitude, it really gets my day off to the right start. It might also be something like watching a movie. In our family, we spend a lot of time watching sunrises and sunsets, and even just noticing the moon in the sky or a beautiful constellation or something that we might see, and often taking pictures of those things and sharing them with others. So if you hop to the next slide, that's actually an example of savoring a positive event. So when we savor a positive event, we call it turning up the volume on those positive events. It extends that good feeling. It helps us to continue to cope with stress, and it also allows us to recall those good feelings and those healthy brain chemicals that our brains experience when we sit with these positive emotions. And then finally, I just want to introduce you again to one of the other skills that we talk about. It's the concept of gratitude. And we talk about gratitude as being a feeling of thankfulness and appreciation. And it really gives us that opportunity to pause in our day and maybe experiencing a moment of reflection, again, a reflection potentially on a positive event that happened, and just sit with that feeling of thankfulness and appreciation. If we had more time today, I'd encourage you to just pause for a moment and experience those activities yourself. After your day today, I encourage you, or after this presentation today, I really encourage you to take just a couple of moments and recall for yourself a positive moment that happened your day. Think about savoring it and turning up the volume by really sitting with those feelings and emotions, maybe telling someone about it or reflecting on it, maybe journaling about it. And then also taking some time to experience just a moment of gratitude. And again, can be connected to that positive event, or it can be something else. But just notice the feelings that you experience, but also notice any body sensations that you might have, and maybe even how your behavior or your mood or the rest of your day goes after you take that time to really sit with those pieces. The last part that I said I would talk about today is this concept of acts of kindness. And again, just something for you to think about and to ponder is that an act of kindness actually has 3 potential impacts. The person that gives the kindness, the act of kindness, has a positive emotion connection that happens. The receiver of the kindness, the research shows, has a tremendous positive impact from that if they allow themselves to sit with that positive experience and also even maybe experience the gratitude or savor it by telling someone else about it. And the third piece that the research is starting to show is that even a bystander or an observer of an act of kindness has a positive emotion that they can experience from seeing that act of kindness carried out. And so again, after today, I encourage you to go forth with your day, but also to see spaces where you can give acts of kindness. Maybe if you're the receiver of that kindness, really sit with it and experience those emotions it brings you, and also observe and look for the acts of kindness that happen in the world around you. When we teach this skill, I often go back to Mr. Rogers. For all of you that remember Mr. Rogers, I remember a time when the world was chaotic and he was asked, Fred Rogers was asked once, like, how do you handle those moments and how do you talk to children about it? And his wisdom was so timeless to say, look for the helpers, right? And so when our world feels chaotic, when our families feel overwhelmed and stressed, when we look for the helpers or when we look for the acts of kindness, we can really engage in these positive emotions that exist. And so as you go forth today, I encourage you to just pause for a bit and think about, where do you see kindness in the world of chaos that we live in and have lived in for a very long time? All right, closing out our time together, we have recently done some pretty significant evaluation of this program. So we've been teaching this program for 4 years in the state of Wisconsin as a part of our extension program. And we recently did an evaluation of participants, going back 4 years to participants. And we've really learned some phenomenal things from those. So this is just a super brief quote that was shared, and also just a data point, but we have many more data points that we're really excited to be writing up and to be sharing out with others about the profound impact that this work is having. So at the end of the day, the last slide just has our lovely little logo and wheel on there with all the different skills. But you'll have an opportunity to reach out and connect with me. And I think we're staying on for questions later on. So I'd be happy to talk more about how you can engage with this program on a local level after that. Thank you so much, Suzanne, for the time.
Awesome. Thank you, Danette. I loved hearing about the program. Something I've been asking my son every night is what made you smile today? So I challenge you to maybe, if you think about it for a moment, put something that made you smile in the chat so we can all get that positivity and see that as we wrap up with our final speaker. So Mark, I'm going to hand it to you with the 988 Wisconsin Lifeline.
Thank you very much for having me. Good afternoon to you all. I represent the 988 Wisconsin Lifeline. So 988 calls are available nationwide, in fact, in Canada as well. It's been around for a while, the National Suicide and Crisis Hotline, but it used to be a convoluted 800 number. So back in July of 2022, the feds simplified it, and to correspond kind of with 911, it's 988. Some states have 4 or 5 different call centers. The state of Wisconsin has one, and that call center is Family Services of Northeast Wisconsin, based in Green Bay, and that's who I work for. Next slide, please. So real briefly, I just like to point out that I am not a social worker. I'm also not very educated. I love being the third person after educated folks. It's kind of cool. My background is in parks management. I managed county, city, and state parks for about 25 years, 17 of those years in law enforcement. So with that, my outreach focus groups are first responders, law enforcement officers in particular, as well as farmers and older rural men here in Wisconsin. So the next slide is a short video that hopefully kind of ties things together.
988 is the national 3-digit dialing code that connects you to Wisconsin's 988 Suicide and Crisis Lifeline. The 988 Wisconsin Lifeline is here to support you with concerns about your mental health or substance use. Anyone in Wisconsin can call or text 988 or use the chat function at 988lifeline.org to get the help they need. What happens when you contact 988? After a person calls, texts, or chats, they receive an automated response with options for veterans, Spanish speakers, LGBTQ+ youth, and young adults. The person is then connected to a counselor. The most common experience is over 98% of people receive support and local referrals, de-escalation assistance from a crisis, learn new coping skills, and may receive a follow-up call. If there is a high concern of risk to self or others, the person will receive a required wellness check from law enforcement. In a situation where there is urgent risk of serious harm to self or others, the person will receive a required emergency law enforcement and medical response. If you or someone you know is in serious immediate danger, call 911, not 988. The 988 Wisconsin Lifeline 24/7 call, text, chat is supported by the Wisconsin Department of Health Services. For more information, visit 988wisconsin.org. 988 is the
Great. So hopefully that video kind of explains it, pretty easily in terms of what happens when you call 988. I'm just going to run through it here real quick and also mention that you can get on the Wisconsin Department of Health Services website and print this exact sheet, as well as the next slide that I'm going to show here in a minute. So the person calls, chat, or text 24/7. You're going to get connected to an automated response that's going to ask you if you're a veteran, LGBTQ, Spanish speaking, that kind of thing. And then you'll get contact or connected to an actual counselor. And I'm here to tell you all, folks, you're lucky to be in Wisconsin. We've got a really good group of folks that are on the other end. We've got about 75 call counselors that answer almost 10,000 calls, chat, and text a month. And they're very well educated, and they have a culture of least invasive action based on what they do. In the video, it mentioned 98% of calls are resolved without having emergency response. In Wisconsin, it's more like 99.5 plus, quite honestly, and we're quite proud of that. Next slide, please. So I mentioned earlier that 988 is the National Suicide and Crisis Hotline, and that is very true, but I'd also like to mention that it does not have to be for imminent suicide. It does not have to be an emergency. It can be for upstream mental health, and it's going to be one of our takeaways today that I want hopefully everyone to get. So it's common that folks don't want to call 911 unless it's an emergency, and I think some folks think, well, 988 is the same way. It needs to be for someone that is imminently suicidal, and that is not the case. So another point I'd like to make is you can call 988 on behalf of someone else that you're concerned about, and you may be looking for resources, you may be looking for all kinds of different things. If you look in this particular slide, which is a great visual, and again one that you can print off of the Department of Health Services website, 988 is for thoughts of suicide, mental health crisis, substance use crisis, emotional distress, and referrals to all kinds of things. They can refer you to financial resources, food, shelter resources, utility resources, and all that kind of thing as well. The service is 100% free. So that's another point that I'd like to certainly point out. And you can do it not only for someone else, and you're calling for them trying to get information, but you can sit down with someone as a third party. And I mentioned this when I talked to law enforcement officers, and on some of their calls, they can do this. And I wish I would have had that knowledge and ability to do so when I was in the field. Next slide, please. So again, our takeaways. The 988 is the National Suicide and Crisis Hotline, but it doesn't have to be just for that. It can be for what we call upstream mental health support, which can be just talking to someone, right? And when we mean upstream mental health, we mean trying to get a problem before it becomes a crisis. This is a picture of me in my canoe in the Upper Peninsula of Michigan. Ironically, this is my upstream mental health support. It's getting out into the wilderness. Another takeaway is law enforcement is only coming if it's an imminent risk of harm to yourself or someone else. So that's a common myth that is spread out there that we just like to get out of the way. Next slide, please. Let's go to the questions portion, and we can skip right past that to the next slide, which was just a recap again of this one because it's so good. It really is. I encourage y'all to get on the Department of Health Services website and print a bunch of these. The backside, you can have it printed to be county specific to point out different county resources and that sort of thing. And then finally, the last slide is just my contact information. If I can ever help anyone out in terms of what 988 is, perhaps you have an event based like a suicide walk, awareness prevention walk, that kind of a thing, I would be happy to talk to you about that. I am a free service, so I'm not out here trying to make dollars off you. And that's all I have. Hopefully a couple of questions, and hopefully you learned a little bit about 988 if you were not already familiar. Thank you.
Awesome. Thank you, Mark. And thank you everyone for sharing. I know we kind of ran out of time a little bit with so many great speakers and so much great information to share. So we are going to get to Q&A in just a minute. But first, I just wanted to share that when you do exit Zoom, you will be automatically directed to an evaluation survey to share your thoughts. And those who complete the eval and submit their email address will be entered to win a t-shirt that's pictured on the screen. And the winner will be chosen by the end of this week. So really encourage you to fill out that evaluation survey. And next for our Age Well series webinars, we have one coming up on June 5th, talking about sleep health as we age with Dr. Benjamin. So be sure to register for that if you haven't already. And one more thing before we get into Q&A, I wanted to share that Global Loneliness Awareness Week is coming up 9th through the 15th. This year's theme is meeting loneliness together. So kind of a common theme that throughout the presentations today were that impact of connection and loneliness. So that really starts with all of us. So taking time to do something for somebody and encouraging you to take action. So what you do really doesn't have to be big or take a lot of time, like Danette shared, doing those random acts of kindness, participating in an event, maybe sitting down with someone and calling 988 if they're experiencing that loneliness or need some resources or experiencing suicidal ideation. Amy is going to drop in the chat a link to a random connection idea generator. So you can see on the screen just one thing that you can do during Global Loneliness Awareness Week. And really any time is to thank someone that you feel grateful for and explain why. So we really encourage you to do something, whether it's big or small, during that Loneliness Awareness Week. With that, I will bring us to Q&A. So if there's any questions for either or any of our presenters today about 988, about mental health as we age, or the We Cope program, feel free to drop that in the chat or come off of mute.
I have a question for the We Cope program. How does a person get referred for that? Is that just within the UW system or through behavioral health?
It's a great question. So we have educators across the state of Wisconsin that are teaching this program, both in person and virtually. We're in the process of building out a statewide calendar of recurring virtual events. And so while that's not available at this time, I will put into the chat the website. And so you'll be able to go to that website and look for updates and information. We hope to be building out that calendar of opportunities to join virtually, but you can also connect with your local extension office and see if there's an educator in that office or in the general area that is teaching the program and or would be willing to offer it.
Thank you.
I will just add to that right now, because we've had grant funding, we are able to offer this program free of charge. There may be a point in time where we do have to request a small fee to cover the cost of materials for our print materials if we use them, but we do also have virtual materials that we can utilize as well. So right now the program is offered free of charge across the state as well.
Great question. Thanks, Danette.
Mm-hmm.
Any other questions for our speakers?
I had a direct one, and just know that I'm going to address that separately. Thank you.
Awesome. Thank you, Mark. And I see the link for We Cope in the chat. I'm not seeing any other questions come through. Again, thank you, Dr. Adu. Thank you, Mark. Thank you, Danette, for sharing all of your great resources and more information on taking care of our mental health as we age. Like we shared at the beginning, a recording for the webinar will be sent out probably within the next 24 hours, along with the slides for today. So again, thank you everyone for attending. And I really encourage you again to think about those things like Danette was sharing that make you smile, or to take a moment today to practice some gratitude. Have a good rest of your day, everyone.
Thank you.